Have you ever heard of someone wanting to eat something that isn't food? It might sound unusual, but it is a real medical condition. This condition is called pica. It is defined by a persistent craving and consumption of non-food items. These are substances that have no nutritional value. Pica is more than just a strange habit or a quirky behavior. It is a sign from the body, a signal that something is not quite right internally. The name pica comes from the Latin word for magpie, a bird known for its unusual eating habits, collecting all sorts of objects. It's a fitting name for a condition that involves such a wide range of non-food cravings. The cravings associated with pica can be very specific and powerful. A person with pica doesn't just idly chew on a pencil. They feel a compelling urge to eat a particular non-food substance. This urge can be as strong as the craving for a favorite meal when you are very hungry. The items people crave can vary dramatically, from things found in nature, like soil or clay, to household objects like paper or soap. It is important to distinguish pica from the normal behavior of infants and toddlers, who often explore the world by putting objects in their mouths. For a diagnosis of pica, the behavior must be persistent for at least 1 month and be developmentally inappropriate for the person's age. Understanding pica begins with recognizing it as a complex disorder. It is not simply a matter of poor choices or a lack of self-control. It sits at the fascinating intersection of nutrition, psychology, and physiology. The body and mind are intricately connected, and pica is a perfect example of this link. When the body sends out a signal for a craving, it is trying to communicate a need. However, with pica, that signal gets scrambled. Instead of reaching for a spinach salad to get iron, the brain might trigger an intense desire for the metallic taste of clay or the gritty texture of sand, which is a confusing and often dangerous misinterpretation of the body's true requirements. This condition can affect anyone, regardless of age, gender, or cultural background. While it is more commonly observed in certain populations, such as young children and pregnant women, it can manifest in adults and adolescents as well. The key is that the craving is not a fleeting thought, but a persistent drive. This drive compels the individual to seek out and consume substances that our bodies are not designed to digest. Recognizing this compulsion is the first step. It allows us to move away from judgment and toward understanding, and most importantly, toward finding the help and support that is needed to address the underlying cause of these powerful and unusual urges. So what causes these intense cravings for non-food items? One of the most common drivers behind pica is a nutritional deficiency. The body is incredibly smart. When it is missing essential nutrients, it can trigger cravings. The most frequent culprits are iron deficiency anemia and zinc deficiency. Your body needs iron to make healthy red blood cells, which carry oxygen. When iron is low, you might feel tired and weak, and your body might develop a craving for things like dirt or ice. This is thought to be the body's misguided attempt to find the missing minerals, even if the craved items do not actually contain them in a usable form. Beyond nutrition, mental health conditions can play a significant role. Pica is sometimes associated with developmental disorders, such as autism spectrum disorder, where sensory-seeking behaviors are common. The texture or taste of a non-food item might provide a form of sensory comfort or stimulation. Stress, anxiety, and trauma can also be powerful triggers. For some individuals, the act of eating a specific non-food item can become a coping mechanism. It can be a way to self-soothe during times of high stress or emotional distress, providing a temporary, albeit harmful, sense of control or relief from overwhelming feelings. Pregnancy is another time when pica can emerge. The demands on a pregnant person's body are immense. Nutritional needs, especially for iron, increase dramatically to support the growing fetus. This can lead to iron deficiency anemia, making pregnant women particularly susceptible to pica cravings. The most common form seen in pregnancy is geophagia, the craving for earth, clay, or soil. While sometimes linked to cultural practices, it is often a clear biological signal that the body is in desperate need of more minerals. These cravings usually appear during pregnancy and often disappear on their own after the baby is born and nutritional levels are restored. It is crucial to understand that these causes often overlap. A person might have a pre-existing nutritional deficiency that is then made worse by stress, leading to the onset of pica. For example, someone living in a high-stress environment might not be eating a balanced diet, leading to low iron levels. The combination of the physiological need for iron and the psychological need for comfort could manifest as a strong craving for something like chalk or paper. Unraveling these interconnected causes is key to finding the right treatment. It is not just about stopping the behavior, but about addressing the root problem, whether it is in the diet, the mind, or a combination of both. The list of items craved by people with pica is extensive and can seem very strange. One of the most common categories is geophagia, which includes eating dirt, soil, or clay. Another is pagophagia, the compulsive consumption of ice, often linked to iron deficiency. Some people crave amylophagia, which is the desire to eat uncooked starch, like cornstarch, flour, or laundry starch. Other commonly reported items include chalk, hair, paper, soap, paint chips, pebbles, charcoal, and even cigarette butts. Each craving is highly specific to the individual, driven by a complex mix of sensory appeal and underlying biological signals that have gone awry. While these cravings might seem harmless at first, they pose significant health risks. Eating non-food substances can be very dangerous for the digestive system. Items like hair, stones, or paper can cause serious internal blockages in the intestines or stomach, which may require surgery to remove. Sharp objects like pebbles or paint chips can cause tears or perforations in the lining of the digestive tract, leading to internal bleeding and life-threatening infections. The digestive tract is simply not equipped to break down and process these materials, turning a seemingly simple act into a major medical emergency. The dangers are not just mechanical. Many non-food items are toxic. Paint chips, particularly from older homes, may contain lead, leading to lead poisoning. Lead poisoning can cause severe developmental delays in children and serious neurological problems in adults, including memory loss and headaches. Eating soil or clay can expose a person to harmful parasites, bacteria, and heavy metals that can cause severe infections and long-term health complications. Even seemingly clean items like laundry starch or large amounts of ice can interfere with nutrient absorption and cause damage to tooth enamel, creating a host of downstream health issues. Furthermore, the act of eating non-food items can directly interfere with the body's ability to get the nutrition it actually needs. If a person's stomach is full of clay or paper, they are less likely to eat nutritious food. This can worsen the very nutritional deficiencies that may have triggered the pica in the first place. It creates a dangerous cycle. The deficiency causes the craving. The craving leads to eating non-food items, and eating those items prevents the body from getting the nutrients it needs, making the deficiency even worse. This is why addressing pica is not just about stopping a behavior, but about breaking a harmful cycle and restoring health. If you suspect that you or someone you know has pica, the most important step is to speak with a doctor. It can feel embarrassing to talk about these cravings, but it is vital to remember that pica is a medical condition, not a personal failing. A doctor will approach the situation with understanding and without judgment. They will likely start by running some simple blood tests. These tests are crucial for checking levels of iron and zinc, as identifying and treating a nutritional deficiency is often the most direct way to resolve the cravings. This simple first step can provide clear answers and a path forward. Once a diagnosis is made, treatment will be tailored to the underlying cause. If a nutritional deficiency is found, the solution is often straightforward. A doctor will prescribe supplements, such as iron or zinc pills, and provide dietary advice to help restore healthy levels. For many people, especially pregnant women or those with anemia, the pica cravings disappear completely once their nutritional status improves. It can be a remarkably effective and rapid solution. The body gets what it was truly asking for, and the confusing signals for dirt or ice simply fade away, replaced by normal hunger cues. If the cause is related to mental health, stress, or a developmental disorder, the treatment approach will be different. A doctor may refer the individual to a psychologist or therapist. Behavioral therapies, such as cognitive behavioral therapy, can be very effective. These therapies help individuals develop new coping mechanisms for stress and anxiety, and they can provide strategies to manage the sensory-seeking behaviors associated with pica. The goal is to replace the harmful habit with safe and healthy alternatives, addressing the emotional or psychological need that the pica was attempting to fill. Ultimately, pica is a message from your body. It is a loud, clear, albeit strange signal that something requires attention. It is not a habit to be hidden in shame, but a health issue to be addressed with care. By seeking help, you are listening to your body and taking the necessary steps to care for it. Whether the solution lies in a simple iron supplement, dietary changes, or therapeutic support, there is help available. Recognizing the craving for what it is, a sign to look deeper into your health, is the first and most powerful step toward feeling better and restoring your body's natural balance.